is one of the most important parts of a psychiatric initial examination. The social history is something that really is not a part of many other medicine disciplines or nursing disciplines. When you work in primary care, you just don't have time to gather a complete social history. When I worked in neurology, we were too busy tapping reflexes and doing physical exam to find out what was wrong with the patient, and we didn't have time to truly gather a big social history. A psychiatric exam gathers a big social history, and sometimes I find that it's one of the lengthiest parts of the time that I spent with a client for the first time. So what are some of the things that you should include in a social history? I like to just structure it from beginning to end. So I start with the simple question, where were you born? And then I go into developmental things. For example, well, first off, I asked if there were any problems with pregnancy. Was your mother using drugs or alcohol or smoking? Were you born premature? Were there any medical problems when you were born? And then the next few years, were there any developmental delays or things that people noticed, or injuries like head traumas or encephalitis, infections, things like that? Then going on, who were your parents? I write down their names and their occupations. Not just their biological parents, but also whoever raised them. So if there were step parents involved, or foster system, or maybe they were raised by a older brother or something, you never know. So finding out who raised them. Their marital status of the parents, like was it a biological mother and father that raised you and they're still married, or they got divorced. I put what age the divorce happened for the child. Then I record siblings, and I put birth rank order, like who was born when. And were you close to your siblings? Maybe you had a sibling that was 15 years older or 15 years younger or something like that. Then, did you have any trouble in school? Any learning disabilities in school? Did you get in trouble a lot? Were you in trouble for any reason in school? Any legal trouble? I definitely asked that as an adult, but also before we get to graduating from high school. After I kind of gather some of that school age information, you could throw in things like sexual history and drug abuse or alcohol use or smoking at a young age. But I ask an open-ended question that usually goes something like, tell me what it was like for you growing up. Or give me 2 words or 3 words to describe your childhood. And then from that, I segue into the question about trauma and abuse. If they say childhood was bad, I ask why. Can you describe why it was bad? And then I ask specifically, was there any abuse, physical, emotional, sexual abuse going on that happened to you? And then I rephrase it in another way. I say, do you have any bad memories or traumatic things that happened to you while you were a kid? Sometimes I will collect an adverse childhood experiences scale at this point, the ACEs score, 0 to 10, and I'll document that in my note. Okay, so then, did you graduate from high school? If you did not graduate, how far did you go in school? Did you get your GED? After high school, I always put where they graduated, just like I put where they were born, but where they graduated from. And then what did you do after graduation? Did you go to college? What did you major in college? How far did you go in college? Did you join the military? If you work for the VA, you have to document a pretty big paragraph just on military history, including their rank, where they served, deployments, did they see combat, Do they have PTSD from that? The PTSD question applies to all the trauma, of course. Then, were there significant relationships coming out of high school, through college? Did you get married? Do you have any children? I document the names of spouses, the names of children. Have you had any divorces, any major breakups, any legal trouble? For example, domestic violence would fall into that, or any other legal trouble. Then I always ask, what do you do for a living? What kind of jobs have you had? What kind of job are you working now? Are you on disability? And if they are on disability, I always put why and when. Then, who do you live with now? Assess the housing situation. Maybe they live in a one-bedroom house with 15 people. Maybe they live by themselves. Kind of clues you into various risk factors for things like domestic violence or being alone and being a suicide risk. Economic struggles. Are you making enough money at your job to pay your bills? Are you receiving any government assistance like food stamps? I always ask about pets because people love talking about their pets. And I put down the names of their pets so I can remember at a later visit to ask them about their pets. Then talked about the legal. Then I always throw in a spiritual question. Do you have any strong spiritual beliefs? Are you affiliated with any organized religion or church? And that pretty much sums up the social history. This is a place where I really feel like I'm able to connect with clients because I'm interested in their life and this is where I get to know them and what has shaped them and made them who they are today. It also helps clue you into some important diagnostic clues like did you have bipolar or some kind of mood disorder when you were younger in high school, or did you have ADHD or a developmental disability? What's your average IQ roughly? Are you able to function in society and hold down a job? Were you able to go to college? Were you able to graduate from high school? Things like that. And then, of course, what's your trauma load that you're dealing with? And how are we going to start working to address that? Sometimes I circle around after asking the abuse and trauma questions and I ask the PTSD screening questions or things like, are you having flashbacks? Are you having nightmares? Are you hypervigilant? And so that kind of, you can segue off of the social history. As I gather the social history, I do it specifically after I do the history of present illness, but a lot of times I'm throwing things into the social history as we go because they'll tell me about their job or they're stressed out about a divorce or something like that, and I'll put that into the social history because that's all part of the social history, but it's also kind of up in the HPI also. So, okay. If you have any questions, put them in the comments or send me a question if you want to know more about how I gather a social history. And if I forgot something or I left something out, which happens, I'll forget one of these things and then I'll pick it up at a later visit with the patient. I learned that working in primary care. You may run short on time getting your full, complete social history. Just leave it for a follow-up appointment in 2 to 4 weeks, and then you can ask further questions. Sometimes I'll even leave myself a note in my plan that says, ask about marriages or divorce or whatever I forgot. So, okay, thanks a lot for watching.